Thank you very much. This is Dr. Clark Hansen. Thanks for tuning in. This is one of the most important periods of the history of this earth, and it's a scary time. It's a time of intensity that we haven't known before, lots of concerns of the unknown, and frankly, I want to give some consolation to my patients and some hope. We live in a world where right now the media has just got us all sensationalized and watching the data every minute of this increasing exponential growth of this new novel coronavirus. COVID-19 is the disease. SARS-CoV-2 is the name of this virus that started in China in apparently end of December was the first time we heard of any cases, and is now spread across the world in 198 countries and continuing to increase at exponential growth rate, logarithmic growth rate, and we're trying to get that contained, but all the data is just overwhelming. Matter of fact, we are overwhelmed by data. We have so much data, but not enough common sense. Too much data, and I think that's part of the reason everybody is scared to death. So far, it's not as severe as the common flu is annually, which causes 50 million cases of flu illness every year and 50,000 deaths. So we're nowhere close to that yet. We've already hit that level here in the U.S. This has the potential to do twice that much, so that is terrifying. However, if we only hear the negatives, our immune system is just stressed out more and more, and that stress suppresses our immune system. That makes us worse. So literally, the contagion of fear is spreading faster than the contagion of the virus, I believe. And we need to use our common sense. We need to be able to use our scientific minds to develop something to fight this virus for sure, but the greatest thing we have is our own immune system. So fear, too much fear, and not enough faith in our own body's innate healing ability, our own immune system. Matter of fact, God gave us two immune systems. I believe the body has the inherent ability given by God to heal itself in most cases. And we have two immune systems I want to talk to you about. The humoral immune system is the immune system that creates antibodies. And conventional medicine in the world right now is focused on creating a vaccine to stimulate antibodies. That's going to take 12 to 18 months. That's not what we need right now. I mean, in the future, if it works and it was safe, that'd be great. Often they're not so safe, and they don't always work. So what do we do right now? We have a second immune system that we need to be focusing on, which is the cellular immune system. It's called innate cellular immunity. That's the other half of our immune system that we need to actually make antibodies work as well. And that's something that you can actually enhance right now, today. I'm going to teach you what you need to know so that you can actually increase your cellular immunity today so that it'll actually reduce your risk of the serious consequences of this virus by 82%. This is not just something that's a theoretical concept. This is a treatment that has been used for more than 30 years in children with measles. Pneumonia is the critical condition that is caused by measles that causes the death of most children who die from measles. It's not the rash, it's the fulminant inflammatory reaction in the lungs that causes the death of children with measles. And for 30 years we've been using high dose of vitamin A in a specific water-soluble form for 2 days, sufficient enough to stimulate the cellular immune system and bring this under control and reduce the risk of dying by 82%, and the specific risk of dying from pneumonia by 77%. So this is not a theoretical concept. This has actually been proven in real life in 1.2 million plus children around the world. Actually, it's much more than that because by 20 years ago it was 1.2 million. And we've continued to use it every year since then. And the World Health Organization, the CDC on its own website for measles recommends this, and the American Academy of Pediatricians. Somehow everyone has forgotten about this or is overlooking it. Will not extrapolate this data to other viruses. All viruses are unique. However, the cellular immune system is looking at viruses in general. Any virus, it'll attack them all. So I'm going to tell you about that today. So I want you to learn to focus on the positive and not so much on the negative. If we're just watching those numbers tick up every day and the number of deaths every morning, the number of new cases, it's an exponential growth that is very concerning. And I want you to focus on, number one, the fact that 95 to 96% of the cases are mild. So it's highly contagious virus, but mostly mild. 95% of the cases are so mild that it's like a common cold. At worst case, a flu-like, maybe a moderate flu-like syndrome, but only 4 to 5% of the population is having serious complications from us. And those are the people that we should be focusing on, and we want to take care of and not forget. Those are the ones that really should be quarantined to protect them from exposure. And that would leave the rest of us, the 95% of the rest of us, to be about our lives. If we can enhance our own immune system, we could be resistant. We're not hiding from every cold. Coronavirus is actually a cold virus. It's been around for years. There's 4 different types that are endemic on the planet. It means every year they come back. They're mild. We don't even know we have it. We just say it's a cold. Probably all had some type of coronavirus. There's also rhinoviruses. Flus are the ones that are the most severe. So the coronavirus, if you look on Worldometer, and I have on my website, you'll see the coronavirus cases listed there, and every day they post the additional world numbers and the United States numbers. And what I want you to focus on is not so much the numbers each day. 471,794 this morning cases of coronavirus, 21,297 deaths, 114,703 that are recovered in the world. And then what I want you to look at underneath that is the active cases, 335,000, so a little bit less, of course, eliminating the ones that have been recovered. And then you'll see underneath that 320,999 cases that are mild. So there's 96% of the population is having mild cases. This is the thing you have to remember. You want to be in that 96%, 95 to 96%. And how do you do that? And we're focusing on this 4%. Yes, that is overwhelming our healthcare systems right now, and the fear of the numbers multiplying as they could if that continues to happen. And you'll see in the case of in the United States, there's obviously been 68,000 cases so far and 1,000 deaths. So again, that's a horrific number of deaths. That's a scary number of deaths, but mostly it's because we don't know about the deaths that are happening from the annual seasonal flu that we have every year, which, as I said, attacks 50 million people every year. This year, the CDC says they estimate the numbers to be between 40,000 and 54,000, or excuse me, 38 million to 54 million cases so far this year, and somewhere between 23,000 and 59,000 deaths. So if you take the higher number, 50, just say 50,000, there's about 50 million cases of the flu every year and 50,000 deaths. So far in the United States, we're only at 1,000 deaths of this, and we want to keep that way. So what we want to do is increase our immune resistance so that that number of serious illnesses goes down farther and farther. So there was a new report recently out of China, or data from China, that there are 10 times more asymptomatic cases than confirmed cases. 10 times. So right now, if there's 68,000 confirmed cases, that means there's 680,000 total cases. 10 times more people who've already had this virus, who had such mild symptoms, they didn't even know they had it. We've had recently, all the basketball teams were being tested, and we're finding a lot of these healthy basketball players, superstars, who test positive for the virus but have no symptoms. They're being quarantined. They'll go through their whole quarantine and not have any symptoms. Why? Because they're already over it. Their immune system is strong enough that they are getting the infection, and the symptoms are so mild they don't even recognize it. They think they have a little cold. And that's what we want to see. That's what a normal cold should be. As we age, our immune system declines. The thymus gland you have behind your sternum is the gland that stimulates the cells of the cellular immune system to mature and to be able to fight off infections. That atrophies as we age. So somebody over 85 has a very small thymus gland. The epithelial lining of their lungs is dried and brittle and ineffective to fight off these infections. So with all these cases that are patients that around us who've had this infection are already immune, we need to find out who they are. We should be testing. This is one of the major downfalls of the United States. The CDC originally came up with a test and they wanted to control all the tests, but their reagent was defective. It wasn't working. And they finally set it out to other manufacturers, and just this week, just yesterday, I found out that there is a new test that I ordered. Thought it would be here today. I ordered to deliver overnight. They just told me they've just received them. They're being shipped out all over the world. We won't have them for a few days, but they will tell us if you have IgG or IgM immunoglobulins to the coronavirus. So you'll be able to determine within a 15-minute period from doing this test, we'll be able to determine if you have immunity to the virus. If you have an elevated IgM antibody titer, that'll show that you've had it for less than 4 weeks. If you have IgM and IgG, that means you've had it for at least 2 weeks. If you have only IgG, that means you've had it for more than 4 weeks, and now you are immune. That's what we need to find out. And even Andrew Cuomo yesterday, the governor of New York, in his daily briefing said, probably hundreds of thousands of people have already had COVID-19, didn't know they had it, and recovered. Should be tested for antibodies so they could go back to work and keep the economy going. That's what we need to be able to be focused on. We need to get everybody tested. You need to find out if you're immune. If you're not, you need to be careful. Don't go around grandma and grandpa. Keep them isolated, but not forgotten. Take care of them. Make sure they have everything they need. Make sure they have vitamin A to stimulate their immune system. And we're going to teach you more about that in a minute. So on my website, you'll also see the current estimates for COVID-19 outcomes. We need to reduce these numbers. The numbers are somewhere like the pandemic flu of 1918, swine flu. 25% of the population, 25 to 30% of the population was infected by that influenza virus that spread around the world. This pandemic, coronavirus, is spreading around the world, probably affect 25 to 30% of the population. There's probably very little we can do to stop it. We can slow it down. That's what we're trying to do right now, is slow it down so it doesn't overwhelm our healthcare departments, the hospitals, emergencies. So they don't know what to do. All they can do is give IV fluids and palliate the patient if they get severe obstructive pulmonary disease because of the inflammation, pneumonia. They put them on a ventilator, a mechanical machine that helps pump their lungs and get them oxygen. You don't want to wait for that. There's something you can do today. So there's 1,032 deaths out of 68,472 cases. That's a current case fatality rate of 1.5%. 1.5%. SARS was 10%. This is a very contagious virus, but it's very mild and not as, the death rate is much higher than the flu, which is 0.1%, but it might actually end up being more like 0.15% in the end because of all these cases that we are now having that are not confirmed. We didn't know people had. As soon as we get testing, we'll find out. So how can you reduce your risk of dying from this disease is the real concern and question. That's what we want to do, is be able to teach you how you can strengthen your immune system and reduce the case fatality rate. And the studies have shown for case of measles, we can reduce that case fatality rate significantly, 82%, by taking 200,000 international units of vitamin A daily for 2 days. This was even given to children ages 1 year to 12 months to 2 years, up to 6 years. Anyone can take that dose. So it's safe for children. It's a very high megadose, but it's the dose you need to stimulate your immune system. For children ages 6 to 12 months, they can take 100,000. Children birth to 6 months can take 50,000 units. This is all on my website, so look up the information and do this specifically, and you'll reduce your risk of dying by 82%. We can reduce this case fatality rate from 1.5% down to 0.27%. That is a huge difference. So instead of having a death rate of 1.5 million expected due to this virus. It could go down to 250,000, 266,400 to be precise. That's what we want to do. We don't know the actual numbers, so we're all making estimates, but we can reduce it by 82%. If everybody would do this. This is an inexpensive treatment. It's something you can all do today if we can get enough vitamin A. We've had a hard time actually getting it. The company we normally buy it for our patients said they weren't going to make it anymore at the dose we give, which is 25,000 per capsule, because you got to take 4 of those twice a day to get your 200,000. And so we bought up all they had, and we could only get a couple of hundred bottles. So we're trying to make more and provide that. The government should do this. Somehow we need to get the message to Anthony Fauci, the head of the government's Health and Human Services, Infectious Disease Division, Immunology and Allergy Division, and we've got to start focusing on the cellular immunity. So let me tell you what the cellular immunity can do for you. So there's these 2 immune systems we have. Humoral is antibodies. That takes 2 weeks for the immune system to create a blueprint and then start to multiply antibodies. Antibodies are like sending out drones to fly around and find the viruses and bind to it and slow it down. It like gums up the virus's transport. It can't move through the body. And so that slows it down for the cellular immune system to come along and actually spray it with toxic chemicals and kill it. The cellular immune system can be enhanced due to that separately. So you'll see on my webpage under this post all about the B cells and how they are activated. It takes 2 weeks before they can start to make antibodies, get the blueprint, and then they start to multiply. And the body will make thousands, hundreds of thousands of antibodies to go throughout the body. But that takes a while. So the first time we get a new virus like this coronavirus, our bodies don't have any antibodies. We've never seen it before. It takes 2 weeks to get that blueprint. It'll take 12 months to 18 months to get a vaccine. That's way too long to wait. So you need to focus on your cellular immune system. So the cellular immune system includes cytotoxic T cells, helper T cells, natural killer cells, monocytes, macrophages, and there's 2 types of macrophages. One type that increases inflammatory chemicals to kill the virus, and one to produce anti-inflammatory chemicals to stop the inflammation once they're all killed. Otherwise, your immune system and your lungs will just be overwhelmed by the inflammation. So the cytotoxic T cells actually have like a drill that they put into cells. Their viruses hide inside your body's cells, and the T cells actually have to find them. And they drill into them and they peer inside by using major histocompatibility complexes on the surface. And they have T cell receptors that hone into those and peer inside the cell. They find the virus, then they produce these cytotoxic chemicals that will kill it. And the body has to make T cells and send them to the thymus to mature and develop and promote. So you need a healthy thymus as well. And vitamin A increases thymic function, increases thymus production and maturation of these T cells. It's one of the starting things. Viruses can also not penetrate your body unless it has the ability to get through the epithelial tissue. So if you have strong epithelium, it's like the skin that lines your outside of your body. There's an epithelial lining that lines the inside of your lungs, your nasal pharynx, and normally the mucin secreted sequesters these viruses, and the healthy epithelial lining keeps it out to begin with. And you'll have secretory immunoglobulin A that's secreted there, and your body will start secreting immunoglobulin M, and then in your blood, immunoglobulin G. That takes some time, but the epithelium is the first line of defense. And if your epithelial lining is deficient, you're going to have a deficient response. If you have really dry skin externally, you're going to probably have really dry lining of your mucous membranes in your lung as well. Your nasal pharynx, they're not working well enough. You can increase that with vitamin A, this high dose of vitamin A. It needs to be a water-soluble vitamin A. You can't get the oil doesn't work. Taking only 200,000 one day only doesn't work. These are proven clinical trials they've done 30 years ago. So you have to follow the protocol. So once the virus gets past perhaps that part of the epithelial lining, it secretes an enzyme called neuraminidase, which helps it penetrate even further. That enzyme breaks down the epithelial lining. If that's how Tamiflu or oseltamivir works, it's a neuraminidase inhibitor that's given to most patients as soon as they get to the hospital. But if they've come 48 hours after they already got the infection, Tamiflu doesn't work, and you can't get it otherwise. So there is an herb, elderberry. It's like a blueberry, European blueberry. Elderberries are amazing. They have the ability to inhibit that enzyme. They block a neuraminidase. So it's a natural neuraminidase inhibitor, just like Tamiflu. You can start taking that today to help reduce the penetration of this virus into your body. So if your virus is smart enough to reduce those complexes on the outside of the cell it's living in, then it's going to not be perceived by your cellular immune system. So your body knows this. It has specialty cells for that are sentinels also, natural killer cells. And it will pass through your body looking for these viruses that have a low level of major histocompatibility complexes on them. When it sees that it has one that's unusually low, it knows it's a virus, and it immediately will release those cytotoxic chemicals like a cytotoxic T cell and kill that cell. So the body is amazing. It knows what it's doing. And it's creating all these inflammatory chemicals that are killing the viruses, and then the body also makes monocytes and macrophages. Macrophages are and neutrophils like digest the virus. They actually eat it. They also secrete inflammatory and pro-inflammatory and anti-inflammatory chemicals to first kill the virus and then clean up all the inflammation. So, what's the key to boosting your cellular immune system? It's keeping healthy, number one. Keep your epithelial lining healthy. The real key is vitamin A. If you're deficient in vitamin A, you cannot mount a positive cellular immune response. You got to have adequate levels of vitamin A. And if you increase your vitamin A levels up to this therapeutic dose of 200,000 IUs every day for 2 days, you will create a response large enough that you will get on top of this virus. And I'm saying everybody should take this in advance. Don't wait till you get the symptoms. Although that's the way it was used for the last 30 years in treating children with measles. When the children got to the hospital, they got this 200,000 IU dose for 2 days, reduced their risk of dying by 82%. That's great, but we can all take now a preventive dose. You take it ahead of time. If you don't have symptoms, great. Take it now. Build up your immune resistance, your epithelial lining so it doesn't get into your body. If you get this virus, you want to jump on that dose again. And you should take it every 4 weeks during the coronavirus outbreak, just in case you're exposed to it or it gets into your system. And you should get tested to find out maybe you're immune. If you're immune, you can tell everybody, I can help you because I'm immune. And you can be one of the positive defenders instead of hiding in your house in isolation, cowering in fear, which further suppresses your immune system. So I hope everyone will do this. You do the vitamin A 2 days in a row. Everyone in your house, from your smallest infant to the oldest grandparent. Only ones who are cautioned not to do this is pregnant women. Unfortunately, if you're already pregnant, you need to take a good dose of vitamin A, but it shouldn't be more than 5,000 international units a day because of the risk of causing fetal abnormalities. That developing fetus is too immature to handle that high of a dose. Everybody else could jump on this dose, and if an adult or a child gets this virus, then you're going to do it again. An adult, I'm saying, take it for 4 days if you get the infection, 2 days longer than the preventive dose. Kids should take it just 2 days. That's sufficient for them. Adults take it for 4 days. This is all outlined in the protocol on my website on this coronavirus pandemic panic post. Everybody needs to get that. And so vitamin A boosts, just to summarize, it boosts your barrier defenses. It protects your epithelial lining of your mucous membranes of your nasal pharynx, your nose, throat, your lungs, even your intestines. Those of you who have chronic irritable bowel syndrome, autoimmune disorders, you need this as well. And it will help. If you have those, you probably have a deficiency of vitamin A. And that's why autoimmune cases are lumped in with these concerns for a group that should be extra careful. So aged who are immune compromised by age, thymus atrophy and deficiency of their immune response due to decreased epithelial integrity. Also those with heart disease, diabetes, chronic obstructive pulmonary disease, asthma, and autoimmune diseases. You need to especially take this protective dose. Vitamin A boosts the thymus and cell-mediated immunity, as we mentioned. All these T cells need vitamin A to increase their production, and they're maturing to the point where they can be effective and start producing, multiplying, and making more of themselves. And vitamin A also boosts antibody production. So we're trying to boost antibodies. It takes 2 weeks. We've actually seen that vitamin A will increase your serum immunoglobulins, which is antibodies. And vitamin A is that powerful regulator of inflammation, both pro-inflammatory to kill the virus and anti-inflammatory to clean up so it doesn't go too far and get excessive. So read the studies. The studies are posted there. The reference to the CDC's website where it actually shows this same dose is recommended for children with measles. Vitamin A doesn't know what virus it is. It doesn't actually look at the virus. Your cellular immune system is not actually determining which virus it is and saying, well, I can't treat that virus. It treats every virus the same. If it sees a virus, it's going to kill it. It needs vitamin A to boost it. So, is there a concern about toxicity of vitamin A? Yes, but it's really high. It's 200,000 international units a day for 6 to 15 months. So you average of 11 months. So you'd have to take this same dose instead of 2 days or 4 days. You'd have to take it every day for 11 months to get to a toxicity. Some really sensitive people might see a toxicity at 6 months. What's that toxicity? Nausea, vomiting, diarrhea. It's not severe, and it's not forever. You could overwhelm your liver. Especially if you take the fat-soluble version. You want to take the water-soluble version. Don't take the oil-based. It doesn't work for this. You need the water-soluble version, which is vitamin A palmitate or vitamin A acetate. And then you'll be fine. So this is also spelled out on my website. Look up those numbers. Don't be afraid of taking this because somebody says, oh, vitamin A can be toxic. This deadly disease can be toxic. And you want to prevent it from happening in you and your loved ones, especially your 85-year-old grandparents. They also need zinc, especially. We can all use zinc. Children under 2 don't seem to need zinc. They can be fine without it. They probably have enough the vitamin A if that dose works. But you need zinc to activate vitamin A. It converts retinol into retinal and retinoic acid, the active forms of vitamin A. You need, as an adult, 20 milligrams a day at least. Children need 2 to 12 need 10 milligrams, and teenagers 13 to 19 need 15 milligrams a day. That's enough to activate your vitamin A, but you got to have it. And sometimes there were some studies that were done that showed that this dose of vitamin A wasn't working in adults. That's because they weren't giving them vitamin A. When they added vitamin A and selenium, they found out that it actually worked again. And it's now thought that pneumonia is actually a deficiency of vitamin A and zinc in these patients who are having severe respiratory distress due to an infection. It's due to a deficiency of vitamin A and zinc. And there's one of the studies I posted on the website that is entitled, Is Zinc Deficiency a Cause of Pneumonia? Then there's some other natural ingredients that are listed. The elderberry I talked about, echinacea, andrographis, herbs that stimulate the immune system, and that's something you can take to be proactive as well. And finally, vitamin D. Don't forget vitamin D and vitamin C. A, C, and D are the most important vitamins you can take for your immune system. B for stress. A lot of you are experiencing a lot of stress. And fear and anxiety is going to suppress your immune system. Read up on these other supplements, make sure you're taking the right amounts of vitamin D. Should be 5,000 IUs for an adult. And the ages are listed here, children 2 to 11, only 1,000 IUs daily. Make sure you're doing all these things. Get these supplements and give them to all your family. Stay healthy, and most of all, I want everybody to know that they need to have faith in their innate immune system. Too much fear, not enough faith. Your body is the real healer. It's not doctors, it's not drugs, it's your body. Right now in the ICUs, great doctors, caring, compassionate, they don't know what to do. We need to tell them that they can do this. I heard one doctor finally saying we need to be taking our vitamins. But they're not trained in nutrition. They're trained in drug therapy, mechanical therapy, ventilators, and waiting for a vaccine or a miracle drug. If you get into the hospital, do everything that they have. You're going to need the hydroxychloroquine and azithromycin probably. That's all they have right now. Hopefully you don't get that far. Take these supplements and build your immune system. And the other simple, smart things. You've got to get enough sleep. Deficiency sleep is going to suppress your immune system. Excess sugar. Did you know that 100 grams of sugar will suppress your immune system by 50% and last for 5 hours? Within 30 minutes, your immune system is suppressed by 50% from eating 100 grams of sugar. Most of us do that twice a day, and we've got immune suppression, even though we're eating lots of healthy foods. Maybe we're not eating some healthy foods either, junk foods. So we need to tighten up our diets and improve our diets and stay healthy. This is not a time to panic. This is a time to get resolved, to be serious about taking charge of your own health, and we can do it. And you should share this with everyone you know. This is, to me, an urgent call to decrease this case fatality rate from 1.5% down to 0.27% by everybody taking a mega dose of vitamin A for 2 days. Every 4 weeks until this virus is cleared, or if you get it, jump on it again, you will greatly reduce your risk of having serious complications from this. So I wish you all the best. My office, we will be getting the coronavirus immunoglobulin M and immunoglobulin G testing so we can find out if maybe you're already immune, so you can be one of the people on the defense and support and help others get back to work. There's hundreds of thousands of us out there who are already. I'm hoping I'm one of them. I actually think I am. We'll find out next week or so. I hope those tests get here and everybody can get that test. But everybody get your vitamin A and D and take elderberry. And good luck to you. Keep in touch with us. Make sure you go to my website and sign up for our newsletter so you keep updated. Anytime I get news updates, I'm going to share that with you. And thanks for listening, and make sure you submit comments, questions, and hope to talk to you soon. Thanks.